y-axis here. So you can see that there is a fairly normal distribution at this end. I think this is Fallujah up here with a very high number of violent deaths. And then there was, I think this was in Diyala as well. So a couple with very high levels, but generally fairly normally distributed. And something that this also tells us is the violence is pretty much spread around all the sample areas and not just concentrated in a few areas. And this is important when we think about how the media reports events and what you find in surveys. There's a different type of distribution. This is very interesting. If we look up here at all causes of death, we can see, first if we concentrate on the women, we can see what the demographers would call a J-shaped curve. Pretty normal. High mortality among the children, dropping off, and then rising with the elderly. So if we looked at this for the US, or if we looked at this for Guinea-Bissau, we'd see something very similar to this. But what's remarkable is how the number of deaths among males in the middle years far exceeds that of women. If we look down here, we're looking just at violent deaths or conflict-related deaths. And so you can see some deaths among females in the younger ages, likely to be school children, people out in the streets and so forth. But in women, having the ability to hunker down, to stay out of danger's way, obviously it was a protective mechanism. But for males, didn't work so well. So in the area of 15 to 45 years of age, we see the largest bulk of deaths. Now, are these people involved in combat? They could be. Are these people just going to and from their job as a barber or a butcher or something? Could be as well. And that's one of the problems with survey data is you can't always dissect out what the motives and what the circumstances were. Okay, here's the kind of the busy stuff on the charts. So if we look at the mortality rates, starting here with pre-invasion, and we analyze these in kind of 13-month intervals, we can see the overall mortality or crude mortality rate rising to someplace close to 17 deaths per 1,000 per year here at the end of the analysis period. This is compared, we took our data for the same period of time as 2004, and then we analyzed it, and we get a picture like this. So you can see these track very closely with each other. Even though these are two independent data sets taken from different locations, the results parallel each other very, very closely. Then we looked at excess death rates. So this would be above the baseline figure of 5.5, and you can see these rapidly increased. We looked at violent deaths. These rapidly increased as well, and you can see the difference between these lines is not great, suggesting that almost all the excess mortality is due to violence. Now, the thing that we were surprised about was the fact that non-violent deaths had not increased. In fact, this is what we'd really expected, because in conflict situations, people lack access to health services. They can't get their insulin. They can't go to have their babies in the hospital. So we see a rise in that. We also see situations where there's no electricity, there's no water. A lot of public health issues arise as a consequence, and that's what we'd expected to see. So we were very surprised to see actually dropped a bit here, and only in the last year did it rise. And in the last year, the rise is not statistically significant. It might be the first part of a trend, and there's lots of reasons to think that the health system deteriorating and so forth, we're starting to see a rise in nonviolent deaths. If we were to look at this again in a year or two, we might see this as a significant number. Now, these are the numbers from the people that count bodies in the reports from the media, the body count. And you can see, interestingly enough, that during the period of time that we found an increase in the rates of deaths, body count found a fairly flat graph. Of course, we have to remember they're measuring not all-cause mortality, but they're measuring violent deaths. But to put this into picture, if we were to convert this to deaths per 100,000 per year from violent causes, which is the usual way that this is reported in international literature, we'd be here about 50 using these numbers here, 54 actually. And putting it in context, this is New Orleans, not far behind. Colombia here, South Africa, Honduras, and Johannesburg, about the highest one that I found, although there are parts of Johannesburg that are off the chart there. I know what everybody's thinking here. So here's where Boston is on, on this. So you're safely at the bottom of the league table here. So I suppose a good reason to stay here. Okay, then we tried to map this out according to violence across the country. Now, there's a big caveat for this. Some of these areas had only a small number of clusters in them. One of the problems with cluster surveys is you can't compare one cluster with another. They're not big enough. So we're on a little dangerous statistical ground drawing this, but this gives a general picture of where the violence is in the country. And it's interesting that although there's a lot of violence in Baghdad, it's a kind of a middle violence area, and yet from the media, that's where many of our accounts come from. So we tend to get a picture of more violence in Baghdad than probably there actually is in reality. And here's what our data look like. If we took these rates and turned around and applied them to the population of those areas that we surveyed, excluding those 2 governorates that didn't get surveyed, we find that the most probable number is 654,000 excess deaths, of which 600,000 are from violent causes. And we have a wide confidence interval, but not as wide as the confidence interval before. One of the reasons is, the principal reason is we had more clusters this time, and that has the effect of increasing the precision. So if we looked at this kind of graph, we'd see something that looked like this. So the chance of it being less than 500,000 is about 10%. So this gives a picture of things. We have a real problem with reporting confidence intervals, and so a number of my colleagues have been thinking about other ways to report confidence intervals. So this is what chair of our statistics department thinks. So we should report it like this. Maybe that's how we traditionally do it, but maybe we should report it like this, or maybe we should report it like this, and maybe we should put things like, this is the best estimate, this is more likely than not, and this is the range at which there's a high probability. Anyway, we're still playing with that kind of thing. However, I wanted to just show this graph for statistically minded people to show the comparison of the 2 surveys that we did at independent locations, and these are the confidence intervals around them. So you can see they pretty closely track each other. Okay, causes of death, gunshots, as I said, was a major cause. Airstrikes throughout the time, car bombs, which are the blue ones, you can see becoming more common, but still much less than we would see from gunshot wounds, which are so common, so car bombs are less than the gunshot wounds, and this is what we see so much in the media. Now, this is what people told us, causes of death. In the previous survey, we tried to find out how many people, how many deaths were ascribed to violence, to criminal activity. This time, people couldn't tell. It says so many of the deaths, and you can see here by 2004, 33% of people said they didn't know, or they might have meant they didn't want to say. Could be either way. And there's a lot of sensitivity in these situations, really doing much probing in this area. So I think we were very conservative in the probing, didn't do as much as we should in other circumstances. This is the part that was ascribed to the coalition. The numbers drop. However, if we look at the percentage drop, if we look at the actual numbers stayed the same or actually increased. And certainly a growth in this unknown. And I said this already, the nonviolent, there's more that we need to know about this. And I don't know what this all means. And it needs to have some more probing in this. So our key findings were that the deaths among civilians have risen to large numbers. Gunfire is a major cause. Deterioration of the health facilities is going on. We know that very clearly. Whether this is just a random finding that nonviolent deaths are increasing, or this is the first sign of a trend that's coming, but yet is too early to be statistically significant, I don't know. And there are potentials for errors. Any kind of survey has biases. People might, if they have an axe to grind, they want to select a neighborhood that's more violent. Or if they're fearful for themselves, they may unconsciously try to select a neighborhood that's safer. So with good training and supervision, you try to minimize that, but that's a potential risk. Selection of streets might be a risk. Survivor bias is a huge issue we have trying to look at mortality. Dead people are not there to report in, so we don't know. But in every neighborhood we went to, we asked, are there any houses in the neighborhood where everybody has been killed in some kind of violent event? And in some neighborhoods, there would be one household where everybody had been killed. One of the clusters we did in Fallujah, there were 7 households in that area where everybody had been killed in a violent event. So this is a real issue. And population migration. This is something that really can skew numbers. We asked households about in-migration and out-migration. And so within the households, I think things were fairly steady. But if there's big movement within a country, it changes your denominators. There's a number of issues that can complicate things there. And then there's errors in asking questions. You know, people may not have asked things in the right way. Respondents might not have responded with all the information. They probably didn't hide deaths that had occurred because we had death certificates to back that up. But they may have not reported deaths that actually had happened in some way. And there's the recall bias issues and so forth. We had a lot of criticisms, naturally. One of them is, where are the bodies? There is still a belief that it's not possible to estimate deaths without actually seeing bodies. And then I refer people to the tsunami. You know, do we have accurate data when we didn't find all the bodies there? So that's one of the criticisms. However, there are plenty of evidence about the necessity to make new graveyards and so forth. So that's there. There was a criticism from Paul Bremer's statistician, not statistician, but his pollster in the Wall Street Journal, that we didn't have enough clusters. Well, clusters will improve the precision. So if you want to reduce your confidence intervals, do more clusters. If you want to keep your interviewers alive, you know, maybe you don't want to do too many more clusters. If we wanted to compare one governorate to another governorate, we'd have to do more clusters, more in each one of those. But we chose to do a national sample rather than try to localize in a particular area. There was a criticism from a psychiatrist in UK saying, how could 2 teams visit 40 households in a day? Well, anybody who's done surveys knows it depends on the length of your questionnaire and the other things you do, and many of us have easily done that number, so that's not a key issue. A group of physicists in Oxford complained that our sampling method favored the principal streets, where they interpreted that most of the killings may have occurred. In fact, we went out of our way to try to include all the streets in the sampling frame. And of course, the other thing we found is most killings occurred away from home anyway. So that probably didn't add much to bias if it had even existed. There were limitations to record keeping. We had some criticism that we could not produce a record showing which households were visited and who the names of people were and so forth. We intentionally did not record that because we felt that the team were stopped at a checkpoint, of which there are lots of checkpoints, and the records were gone through. Some of you may have had this experience where you stop at a checkpoint, people go through all your papers, read everything, and they find certain neighborhoods. That might have increased risk, which we didn't want to do. And then the big problem, and it applies to all of science, we have pre-existing conclusions and assumptions, and the data don't fit with them, so therefore it's a problem with the data. So I just want to finish off here by saying, what are the implications? These are some data that have come from Uppsala, looking at the civilians as a proportion of those killed in conflict. And this is pretty widely accepted, although the data is a bit thin in some cases. So clearly there are more civilians than combatants being killed. If we look at excess mortality, you can see there's a lot of situations in the world where there's a lot of excess deaths among civilians. Congo, where Les Roberts worked, is an example of huge excess mortality. Here are some estimates of deaths in some recent conflicts. And you can look at these. I mean, if you're annoyed with the idea of wide confidence intervals, how about 1 to 3.1 million, or 300,000 to 3 million, or 1.3 to 2 million, or question mark, you know? This is a real problem. And if we look at these are the only ones that we have any good data from, any solid epidemiologic data. So this is an area that has just not been explored. This idea of epidemiology of warfare, I think, is an evolving kind of sub-discipline of public health, and I think that this is an area that we're making a start in, but other people have to do more of this, and we have to find